Good morning, Zinkis and Nevis, and welcome to The Edge for Monday, April 8th, 2024. I am Devonne, Cornelius, and thank you so much for joining me in the program for today. It is about 2 minutes past the 11 o'clock hour. This program is also being carried live on ZIZ TV, ZIZ's social media platforms, such as our Facebook page and YouTube channel. We'll open the phone lines later on in the program, and when we do, you can call us at 469-2555, 465-2555. I said 469 because, I'm a Nevis man, we use 469. 465-2555 or 718-577-2916. That is our overseas line. Those are the numbers you call to participate in the conversation for today. On Sunday, April 7th, we celebrated World Health Day, and across the globe, this is celebrated where a specific health topic or different health topics are explored, where we look at the advancements made in the healthcare sector on the global stage and areas that require improvement. The Prime Minister and Minister of Health, the Honorable Dr. Terence Chu, delivered an address in observance of that day. And we'll have that address played now. Again, World Health Day was celebrated on April 7th, and this is an annual celebration. Let's have that audio played now.
My fellow citizens of St. Kitts and Nevis, today is World Health Day. It is a global health awareness day that is celebrated on April 7th annually. The theme for today's celebration is My Health, My Right. This year's theme underscores the fundamental truth that access to good health is a basic human right. Every human being has the right to the highest attainable standard of health, which is a state of complete physical, mental, and social well-being, not merely the absence of disease. The right to health is interrelated to other human rights, which are in turn linked to the underlying determinants of health, including those factors such as the right to safe drinking water, the right to adequate nutrition, the right to education, and to decent working and environmental conditions. Globally, the overall commitment to human rights in general has declined steadily with adverse effects on health. The aim of this year's theme is to revive the health and human rights agenda. The goal is to champion the rights of everyone, everywhere, to have access to good quality health services. Under the international human rights law, St. Kitts and Nevis has a duty to recognize the right to health. The Federation has an obligation to ensure that all citizens and residents realize the right to health and its entitlements, including preventative care, early screening, treatment and control of diseases, rehabilitation, and access to essential medicines and maternal, child, and reproductive health services. Health is a human right, and it is indivisible from other human rights. It is critical to achieving the Sustainable Development Goals, or the SDGs, and ensuring a sustainable island state. The government of St. Kitts and Nevis is committed to safeguarding every citizen's right to health. The Ministry of Health recognizes that achieving this ideal of the highest standard of physical and mental health requires unwavering dedication to addressing the root causes of health inequities such as poverty, stigma, and discrimination. It is imperative that we advance the cause of universal health care coverage, which is embedded in primary health care, in order to make quality health services affordable and accessible to all. My government, our government, has an unwavering commitment to strengthening the national health system and addressing the current health priorities. The strides we have taken to enhance our health infrastructure and health services include fighting non-communicable diseases, or NCDs. In St. Kitts and Nevis, the fight against NCDs is real. The Ministry of Health has scaled up its health education, health promotion, and health screening activities, along with the adoption of new treatment guidelines. Addressing issues of mental health, priority has been placed on the importance of good mental health by addressing and updating mental health legislation, assessing the issues surrounding substance abuse and abuse, and engaging key stakeholders in the care and treatment of persons living with mental health conditions. Continued surveillance and prevention of communicable diseases. Community nurses have scaled up vaccination efforts for routine antigens, while programs such as HIV and environmental health continue to reach out to the key target groups in the mitigation of disease spread. These efforts are assisted through the strengthening of primary health care services via the increased cadre of trained district medical officers and community nurses. The Ministry of Health continues to strengthen institutional-based health services through 1. Recruitment of specialized doctors and nurses. 2. Improving dietary services. 3. The procurement of the latest diagnostic tools, a computed tomography scan machine or CT scan, magnetic resonance imaging or MRI machine, fluoroscopy equipment, mammography machine, and an electroencephalogram machine. Lastly, determining adequate financing mechanisms to support the implementation of a sustainable national health insurance scheme whereby persons can access secondary and tertiary level care without adverse economic consequences is a must. I call upon everyone to take responsibility for their health, educate yourself, help to promote awareness and support public health interventions. Let our actions reflect our dedication to the principles of equality, participation, accountability, and non-discrimination. I invite all stakeholders to engage in meaningful collaboration and dialogue as we strive to build a healthier, more equitable future for our nation. Together, we can overcome the obstacles that stand in our way and achieve a state of health and well-being that is the right of every citizen. It was Winston Churchill who once said, "Healthy citizens are the greatest asset any country can have." Happy World Health Day.
That was Prime Minister and Minister of Health, Honorable Dr. Terence Drew, speaking on the occasion of World Health Day, celebrated annually on April 7th. And the Prime Minister used the opportunity to make mention of the strides that we have taken to enhance our healthcare infrastructure and health services in St. Kitts and Nevis. And as I mentioned, it is a global celebration where we look at the advancements made. The theme for the celebration is My Health, My Right, and it underscores the fundamental truth that access to good health is a basic human right. Access to good health and access to quality health has always been a topic in St. Kitts and Nevis and across the Caribbean, where citizens continue to call on their governments to ensure that affordable health care is available for all. The issue of people having to, raise funds and all of this financial burden that one or people usually face is a concern, and it is something that we need to look at collectively. And so access to quality healthcare, access to affordable healthcare is very critical, very important. For me, we can't say that we are growing, we can't say that we are advancing if our healthcare is not up to standard, if our healthcare is not affordable, and if we don't have quality healthcare. And so I think with regards to these changes, these upgrades that have been made in our country, they are to be applauded. They are definitely welcomed, and they are definitely needed. But for St. Kitts and Nevis to say that it is growing, for St. Kitts and Nevis to say that it is advancing in various areas, healthcare should not be left behind. The issue of healthcare, or the topic of healthcare, national security, education, these things are very important for the overall development of the country. And so in the address that the Prime Minister gave, he made mention of a number of areas that they have been focusing on. And one that stood out to me was addressing issues of mental health, where he mentioned that priority has been placed on the importance of good mental health by addressing and updating mental health legislation, addressing the issues surrounding substance use and abuse, and engaging key stakeholders in the care and treatment of people living with mental health conditions. Unfortunately, the society that we live in, we don't take mental health very serious. And the reason why I make that statement is because in everyday conversations, people don't usually take it very serious. They would say, yes, we have to take mental health serious, but the actions and the words do not match. And so every year, on World Mental Health Day and, different occasions, we have a huge celebration and we talk about the importance and how good it is to have access to mental health services and all of these things. But when I say we don't take it serious, I'm referring to us as a people here in St. Kitts and Nevis, where our mindset has to change. And the way we look at people who suffer from mental illness. And I think some of us also have to take that step to look after our mental health. It can't just be your physical health, but it also has to be your mental health, because that is a real issue. And there's some people within our communities that are suffering from different type of mental health issues and mental health disorders. Now, in both St. Kitts and Nevis, the Ministries of Health and their mental health unit or whatever, they have been doing their part. But I think it has a lot more to do with the reception by the people, as unfortunately, as I mentioned, some people don't see it as something that is, let me say, real, for lack of a better word, in terms of paying attention to your mental health and seeing a counselor, a guidance counselor, a psychologist. Even that is like a taboo topic. If you are to see a psychologist, people will immediately dump you as being crazy. If you are to suggest to a family or a friend, hey, I think you should go and see a psychologist, go and see someone you should sit down and talk to and, try to work out something, their immediate response would be, I'm not crazy. And so, there's a level of denial there as well. For some people who I've interacted with, they will tell you that they believe that they have some sort of mental health disorder. But when you offer that assistance to them in terms of where they should go to seek help, unfortunately, they turn it down. So it is good to see that we are trying to address the issues of mental health by investing in this area in terms of legislation and engaging, stakeholders in the care and treatment of persons living with mental health conditions. It also spoke to non-communicable diseases, and it says that in St. Kitts and Nevis, the fight against NCDs is real, and the Ministry of Health has scaled up its health education, health promotion, and health screening activities along with the adoption of new treatment guidelines. I think over the weekend we had the cross-channel swim from Nevis to St. Kitts, and unfortunately I found out about it late. I think it was the day of I found out about it. But that is an annual exercise, and activities like that one I mentioned are all geared towards the prevention and control of non-communicable diseases. Swimming is a very great form of exercise. And so you have the cross-channel swim, you have the whole movement of SKN moves where they participate in a number of physical activity. You have marathons. You have all of these activities taking place, and these activities are spearheaded by the Ministries of Health in both St. Kitts and Nevis and other groups and organizations. Usually, you would see whenever people are celebrating something significant, they would try their best to add a exercise component to it. And so if you're celebrating an anniversary or something, they would add maybe a health walk or what have you. But the fight to non-communicable diseases, where people are dying in St. Kitts and Nevis left, right, and center from these diseases, and they're going undetected. Unfortunately, and I'm talking about St. Kitts and Nevis here, we don't take our health very serious in terms of health screening and health promotion, health education, and understanding our bodies. And I say we because sometimes I am guilty of it, but understanding our bodies and knowing what we should do to stay healthy, knowing what we should do to get healthy, and all of these things. And so it is one thing for the Ministry of Health to be, implementing plans and programs to scale up the health education and promotion, and all aimed at the fight against non-communicable diseases. But if we as a people don't accept it and don't participate in all of this, then we're not going to see much benefit. And so on one hand, you have the ministry focusing on preventing non-communicable diseases, but on the other hand, it is not being well received. People are not participating in the activities. People are not going out to take advantage of the free health screenings. And not only does the government participate or host free health screenings, but different groups and organizations. And so I'm using this platform to encourage people out there, whenever these health screenings are happening, participate, go, get a checkup, check your everything, all your vitals, to ensure that you are okay, because prevention is absolutely better than cure. And so if you can find it early, that is what we need to do. Participate in these activities and find any sort of illness that we may be suffering from at an early stage, and not wait until, it has become uncontrollable and you're now fighting to get it under control. It is 20 minutes past the 11 o'clock hour, and you've been listening to me chat for some time. If you're just tuning in, earlier I played an audio from the Prime Minister speaking on the occasion of World Health Day, And we're going to open the phone lines now and begin taking your calls surrounding this topic, World Health Day, and the strides that we have made in healthcare. There is a lot more that we can do, but looking at what we've done. Let's head to the phone lines. We lost that caller. Let's take this one. Caller, good morning and welcome to the program.
Good morning, sir.
How are you doing?
Oh, I'm not doing too bad for my age.
All right.
And good morning to the listening public home and abroad, Carl Brown here. On the speech made by the Prime Minister, one of the things, did he discuss any anger management training for staff in the healthcare services?
He did not, but I would think that falls under perhaps mental health. But no, he did not specify anger management.
Yeah, I think he need that. And as you hear me always being saying, constant training, especially for all areas of the government sector, right? There ought to be constant training and constant anger management classes, seminars, and training. Because a lot of things does happen in these services and departments that the public don't hear about. Like at JNF, we are getting information that there are being fights where people are suspended and sent home, and they are even threatened to turn away. We are hearing of, and that's junior staff, we are hearing of senior staff threatening one another with weapons and threatening them with family members in government. Right? So it seems to be some form of anger between the staff in paternity there. And I think they need some anger management seminar training and classes and constant training of the staff. You always hear me talk about that, because let me tell you, after doing 27 years and 3 months in the health service, and all was at JNF Hospital, never been moved or transferred, the public is not easy to deal with. So you have to constantly have your staff abreast and constantly training, and especially in anger, because sometimes I tell you, it came very close to a lot of time with staff and the public fighting. It came very close.
All right.
So those areas need to think. And before I go, we need to hear from the minister and the water authority. What is all these water rules and problems that all these constituencies, villages, communities are having with water being turned off for days? I mean, I'm sure you hear about St. Peter's water was off since Thursday, right? And St. Paul's now are crying out that the water now turn off 7 o'clock every night. And they said the alleged report is the water being diverted to the big hotel down there.
All right. Thank you for your contribution.
So we need to hear from the folks in water authority what is going on, and if so many other constituencies and communities are complaining of water problem and shortage.
All right, caller, thank you for your contribution. We do have to take some more calls. Let's head back to the phone lines and we'll take this one. Hello, caller, good morning and welcome to the program.
Yeah, good morning, Devonne.
Good morning.
Why you didn't go in the swimming thing from Navy to sink it?
I wanted to participate, but I found out late.
Well, I understand you can't swim, but you could dive. You can't stop, but you could go underneath. Anyway, when was World Health Day? Yesterday?
Yes.
Okay, well, I think 365 days of the week, of the year, supposed to be Health Day. And mental health, mental health will lead people to sanitary health and kill them quick. Because at the Pelican Mall, the bathroom in there, not supposed to have no portable toilet in there more than a week. Down there is a port of entry, and all kind of people from four corners of the earth would have to visit the bathroom to do whatever they have to do. And when someone is going to sit down on a portable latrine or toilet, they can contage some serious germs.
So you're saying that there are portable bathrooms down there? Toilets?
Yeah, for people
so
to
I guess
sit on.
it's just a matter of getting them cleaned then.
No, not there. Not there, you know, because remember portable toilet don't go in here and soak away, you know. So
No, I'm talking about the maintenance of these. If there are portable toilets at the facility, as you're suggesting, right?
Yes.
It's just a matter of getting them cleaned. I don't know where they're going to clean them, but get them cleaned, not to have them being used and they're not being maintained.
For more than 2 weeks, portable toilet not supposed to be in a place like that. Portable toilet, like for more than 2 weeks, supposed to be like you building a house in the mountain, and you know you have that. But a place like a port of entry, no way.
And
so they need to get rid of those and fix the thing ASAP.
Do you know why the portable toilets are there?
Because the natural regular toilet never been maintained.
Oh,
They've been abused and knocked out.
all right.
That's why they had to put in a portable one. But it's time to move the portable and get the stationary toilet them in action.
All right. Thank you for your contribution. Let's take this the caller. Caller, you're on the air. Good morning. Hello, caller, you're on the air. Good morning.
Should be World Health Day, especially for men and men over 50. People, when you reach 50, your body cannot use sugar anymore. You cannot work it down. And I notice a lot of men who don't care about their health. You drinking sweet drink and eating coconut cake and all them kind of things and they're over 50. That's not good for your health. I applaud the Prime Minister with his initiatives to bring in all these equipments so that we could get proper health care. But it's something I want to ask the heads of government, especially of the OECS, what they did to Venezuela, because I was listening to a newscast from Jamaica over the weekend, and Jamaica owe Venezuela $80 million that Venezuela is demanding their money. Cuba get a tanker from Russia with gas, so that means Venezuela stop give Cuba gas. What's going to happen to us, brother, if Venezuela decide to stop help us out like they've been doing for all these years?
Okay.
This is a serious concern to me, because when I listen to ZIZ News, especially ZIZ News, I can't understand it. Just about 2 items on the news agenda, and it's a big news for them.
I don't know. You have any more callers on the line? All right. It is 11:30, and you're listening to The Edge here on ZIZ Radio 96.1 FM. Let's take a break, and when we come back, we'll continue the conversation for today.
Join us every Wednesday for In Focus, a weekly talk show produced by the St. Kitts Nevis Information Service, where we provide exclusives with key persons within the government and discuss pertinent, relevant, and interesting matters that affect us all. Tune in every Wednesday, live on ZIZ Radio and streamed live on Facebook at SKNIS Media and ZIZ Online. In Focus, your government, your business.
Get ready, St. Kitts and Nevis, for the first annual Jesus in the City Parade and Festival on Saturday, May 18th, 2024 at the Warner Park Stadium. Celebrate love for God and love for people throughout the city with festive floats, live gospel bands, choirs, costumes, banners, and paraders filling the streets of downtown Bastille with praise and worship. The opening festivities kick off at 11 a.m. with a parade leaving Warner Park Stadium at 12 noon, moving along city streets and returning to the stadium for a grand gospel concert celebration. Enjoy music featuring special international guest artists, local bands, food and festivities for the whole family. Come lift up the name of Jesus in the city on Saturday, May 18th, 2024. To register your church, enter a float, secure a vendor booth, or to become a sponsor, visit jesusinthecity.com or call 662-8911.
Jesus in the city, hands in the air.
Welcome back to the Edge here on ZIZ Radio 96.1 FM. I'm your host, Devonne, Cornelius. It's 11:32, and you're listening to ZIZ Radio 96.1 FM. The phone lines are open, and we're taking your calls. We are on the topic of World Health Day, celebrated on April 7th. That was Sunday. And the Prime Minister and Minister of Health, Honorable Dr. Terence Drew, issued a message to mark the day and made mention of strides that we have made to enhance our healthcare infrastructure and health services. Now, the Prime Minister, in his message, as I mentioned, he spoke to fighting non-communicable diseases, addressing issues of mental health, continued surveillance and prevention of communicable diseases, where community nurses have scaled up vaccination efforts for routine antigens, while programs such as HIV and environmental health continue to reach out to key target groups in the mitigation of disease spread. He said that these efforts are assisted through the strengthening of primary healthcare services via the increased cadre of trained district medical officers and community nurses. The Ministry of Health continues to strengthen institutional-based health services through the recruitment of specialized doctors and nurses, improving dietary services, the procurement of the latest diagnostic tools, a computed tomography, CT scan magnetic resonance imaging, that's an MRI machine, and a fluoroscopy equipment, mammography machine, and an EEG machine. Lastly, determining adequate financing mechanisms to support the implementation of a sustainable national health insurance scheme whereby people can access secondary and tertiary level care without adverse economic consequences. That is a must, according to the Prime Minister. Let's head back to the phone lines, and we will be taking some more calls. Let's take this one. Hello, caller, you're on the air. Good morning.
Good morning, Devonne. And first, I always want to thank God for the Federation of St. Mary's. Devonne, talking about mental health, I believe that we got too much mental health. Sick people on the road, in the country, in town, all over St. Kitts. And I believe that the family members, them, supposed to be able to take care or take responsibility of the people, them. And they're doing a lot of stupidness. Some of them hauling garbage out the pan and all kind of thing, searching the pan to see if they find anything to eat. And if they not find, if they find a pan, they're not check back in the pan, you know, they'll let it go. And all these things. I'm a good government got to put something in place that when they get mentally ill, to treat them. But some of them, they refuse to take the treatment too. If you don't sick, because some of them they'll tell you they're crazy, you know, they're not sick, you know, nothing wrong with them, you know. It's a kind of hard thing sometimes to deal with them. And can't to a caller, you got to get people to train to deal with these people. You got to got professional people to deal with them. Because them no men, they ain't the mentally sick. They might think that they're in a good condition still. When they're doing, they feel like they're doing the right thing when they're doing something wrong. You understand? And I believe this lot of smoking with this mixed with this brown got a lot of these young men today getting them mentally sick, ill in a kind of young in a young way. You understand? This lot of smoking, this brown they're using, and drinking alcohol, this the same thing with it. You understand? Something need to be done with these young men smoking, just smoking, one in, one out, and mixing this thing with the brown, call it the brown, they say the brown mixed with some kind of thing to pull for it.
All right, Carla, thank you. We do want to take some more calls, so thank you so much for your contribution. You made the point of having trained people to deal with those who suffer from mental health disorders, not family members. Sometimes there are people who suffer from different type of illnesses, but in this case, mental health disorders. And unfortunately, we think the best response to that is to probably lock up that person in a home or in a house or what have you, instead of assisting them in getting real help and getting trained people to deal with them. But it brings me back to the point that I made earlier, that unfortunately in our community we don't take mental health very serious. And I think apart from the government, there are organizations in and around St. Kitts and Nevis, even in the schools, not suggesting that they're not doing anything. But for those who are, do more. Do more. It's not just the physical health, but it is also the mental health. As your physical health, your mental health could impact your physical health. So that is where I think the focus needs to be as well. The Prime Minister in his... Let me stick a pin. We have any callers on the line? Okay, let's take this call. Hello, caller. You're on the air. Good morning.
Yes, good morning, sir, again. Carl here again. Yes. Also, along with training, there ought to be training for security for the staff members too, because a lot of staff members get seriously damaged from these mentally ill people, and it goes naughty, and you're being told that is part of your work. You are to take whatever you receive from the patients because it's part of your job and because they are sick. Those are some of the things you're being told and you're being warned against. And the last thing on health, the promotion. Remember last year, August, lots of nurses had got promoted up the ranks. Well, the nurses, them are asking and are requesting when are they going to get their money to match the rank of promotion. They say nobody is doing anything about it. And since last year, August, they have been promoted and they are still waiting on their money. The money, they have not received their money to match up to their promotion.
All right. Thank you for your contribution to the program. Let's take this other call. Hello,
yes,
caller.
hello.
Yeah.
They want a blessed good morning. Mental health, right? And easy to think, because they have more strength on us. When we got 50%, them they got 100 and something stronger than us. But I ask some of them please to take their medication, and the family can't able to go with them because they're stronger than the family them too. And when they walk out the yard, and a lot of them all in Bastille from all in the countryside, all over. So the family them can't get to catch them too. Yeah, so we just pray and hope that everything go all right with them. Thank you.
All right, Carla, thank you for your contribution to the program. It is 11:40 and you're listening to the Edge here on ZIZ Radio 96.1 FM. If you're just tuning in, we are focusing on World Health Day, which was celebrated on April 7th, and the Prime Minister and Minister of Health, Honorable Dr. Terence Drew, issued an address to mark the day. In his address, he called on people to take responsibility for their health, educate themselves, help to promote awareness, and support public health interventions. He said that our actions reflect our dedication to the principles of equality, participation, accountability, and non-discrimination. I invite all stakeholders to engage in meaningful collaboration and dialogue as we strive to build a healthier, more equitable future for our nation. Together we can overcome the obstacles that stand in our way and achieve a state of health and well-being that is the right of every citizen. You know, I think it's a Nevis turns to or focuses on a sustainable island state agenda. As I was reading this and going through this, we can't have a sustainable island state if our people are not healthy. Physically healthy and mentally healthy. And so that is definitely something for us to think about. And getting quality healthcare in St. Kitts and Nevis, we understand, I definitely understand, is not just the responsibility of the government, whether it be here in St. Kitts or over in Nevis, but it is the responsibility of us as a community. And there are private groups and organizations that I believe can do so much more. They have been doing, but I believe can do so much more to support and promote health education in St. Kitts and Nevis, whether it be mental health, communicable diseases, non-communicable diseases, and, you know, all of these things. It is 11:43. The phone lines are open, and we are welcoming your calls at 465-2555 or 718-577-2916. Do we have any callers on the line? If we don't, we'll take a break. When we come back, we will continue our conversation, and then we'll wrap up for the midday newscast. Stay tuned.
From the heart of ZIZ Radio comes a political talk show like no other. The Edge, with host Devonne Cornelius giving you his take on the biggest stories happening in governance today. Got something to say? Let's hear it. Give us a call at 869-465-2555, Monday to Friday from 11 a.m. to 12 noon. One solid hour of in-depth analysis of the machinery that makes our country tick. The Edge, cutting into the matters at hand.
Jeff, you leaving already, boss? You sure you could drive after them drinks?
Yeah, I could handle it, Ain't too far from here. I'm gonna take my time.
Oh my God, Jeff, you're gone. I told you not to drink and drive.
The problem with drinking and driving is the morning after. Drink responsibly.
This message was brought to you by the St. Kitts Nevis National Council on Drug Abuse Prevention in collaboration with SKNIS.
Hello and welcome back to the Edge here on ZIZ Radio 96.1 FM. I'm your host, Devonne Cornelius. Let's head back to the phone lines and we'll take some more calls. Hello, caller, you're on the air. Good morning.
Good morning. I would like to ask a question concerning the solar eclipse. What are you all doing so that we have a lot of elderlies, right? So that you could make them aware of certain things, because some of them is very itchy. Right? So I'm not hearing anything from, the radio station. So I said I would ask a question. Thank you.
All right, caller. Thank you so much for your contribution to the program. Let's head back to the phone lines and we'll take some more calls. You can call us at 465-2555 or 5772916. If you are just tuning in, we are on the topic of World Health Day, celebrated on the 7th. That was yesterday, and the Prime Minister issued a statement on that. Let's head back to the phone lines and we'll take some more calls.
Hello.
Hello, caller, you're on the air. Good
Yes,
morning.
they want me again. Why some of them don't get so fat with these tablets in the body?
All right, caller. Thank you for your contribution. Regarding we have any more calls on the line? Regarding the solar eclipse, I'm not quite sure if I understood the question from the caller in terms of what we are doing. Is it that you're asking for more information on the solar eclipse? It says that Caribbean islands are in path of partial solar eclipse. So tips and advisories have been issued in some Caribbean territories. So I think you're asking for in terms of what is expected of the population. So I have an article from Loop Caribbean which speaks to the solar eclipse. It says that tips and advisories have been issued in some Caribbean territories which will be able to view the partial solar eclipse. On April 8th, a total solar eclipse will cross over parts of Mexico, the United States, and Canada. So in those areas, there will be a total solar eclipse. But in the Caribbean, particularly St. Kitts and Nevis, Antigua and Barbuda, it will be partial. So it says in the Dutch Caribbean island of St. Martin, the meteorological department says the solar eclipse is anticipated to be visible in various parts of the world. However, the eclipse will only be visible in some parts of the Caribbean. The eclipse will not be visible in countries in the eastern Caribbean south of Guadeloupe. St. Martin will only have a partial view depending on the cloud cover from about 3 to 4 p.m. A very small part of the sun will be blocked out, and that relates to Antigua and Barbuda, St. Kitts and Nevis. The meteorological department reminds proper eye protection, such as ISO compliant solar viewing glasses or solar filters are recommended to prevent eye damage. If you don't have any of these glasses, please don't go and look at the sun. Again, if you do not have any of these that I just mentioned, stay inside. But the department is recommending, the meteorological department is recommending and reminding people to wear proper eye protection, such as ISO compliant solar viewing glasses or solar filters are recommended to prevent eye damage. It says that in Turks and Caicos, the island's National Weather Service in a statement says that Turks and Caicos Islands will experience a partial eclipse. Spectators will be able to view between 20 to 28% of the eclipse. So we won't be seeing much of it in the Caribbean, particularly St. Kitts and Nevis, Antigua and Barbuda, St. Martin. And again, please, if you don't have any of the glasses that I just mentioned in terms of solar viewing glasses or solar filters, then you are encouraged to do not look at the sun. You've been listening to The Edge here on ZIZ Radio. And caller, I hope I was able to assist you with the information that you were looking for. Let's head back to the phone lines and we'll take some more calls. We have a caller?
Yeah.
Hello, caller, you're on the air.
Yeah, Devonne?
Yes, go ahead.
Make it simple. Just tell the whole listening audience what time the eclipse would be passing it, and don't look up. Simple, don't look up. Don't be curious and fast and say, let you take a peep. Because some people will not have on the right protection on the eye, and the feel of peeping through the finger is something. So just don't look up. Mm-hmm. Now, Devon, what really does cause a lot of mental disturbance is when you see people walk honestly and they're being robbed with a pay, that they will make the brightest of person get mental problem. And again, people, be careful when people come and ask you to sign for them to get a loan. They just come with a kind of nice cream and the cake. What I call it, advice and tell you how nice they be and this and that. Is because of the bad habit where they can't go and get a loan easily. And when you don't sign for them and they're gone and they wouldn't send back the money for you to pay, that is what has caused a lot of mental problem. And then people in St. Kitts, so a lot of people in St. Kitts, all they want to do, once they know somebody is popular and they're bright and they're highly educated and they see them acting abnormal, they got to take picture and say, they see this person eating out the garbage pan and all this kind of foolishness. So people, be careful who are you signing loan for in bank. Let who want money go in on their own and live up to their own responsibility. That's my advice to everybody, and then we will have 100% mentally perfect people.
All right. Thank you, caller, for your contribution to the program. To wrap up the conversation for today, with regards to the eclipse that we are to experience, and it's going to be between sometime from 3 to 4 p.m., according to the information I have here. Please do not look at the sun. Sunglasses are not enough protection to view the solar eclipse, and viewing any part of the bright sun directly or without the use of certified solar eclipse glasses will cause severe damage to your eyes. Please be guided accordingly. You've been listening to The Edge for Monday, April 8th, 2024. I've been your host, Devonne Cornelius. Until next time, you guys stay safe. Continue to enjoy the rest of your Monday. Don't drink and drive. Don't text and drive. That's a pandemic in St. Kitts and Nevis. Texting and driving. And yes, you heard right. A pandemic in St. Kitts and Nevis. Texting and driving. Y'all, please stop it. Take care. Coming up next is the ZIZ Midday Newscast.
From the heart of ZIZ Radio comes a political talk show like no other. The Edge, with host Devonne Cornelius giving you his take on the biggest stories happening in governance today. Got something to say? Let's hear it. Give us a call at 869-465-2555. Monday